All right, this is a review over the digestive system or gastrointestinal system anatomy. Um, and because we're getting into the abdominal pelvic cavity, we're also going to do a quick review prior to that over the thoracic cavity, just the compartments like the pleural cavity and the pericardial cavity, and just kind of tie those things together because we got to talk about the pleura, the pericardium, the peritoneum. So those are the serous membranes with their parietal and visceral layers lining these cavities as well, so we might as well tie it together. So here we see the body cavities. Uh, So the ones we're going to focus on, obviously cranial cavities where the brain's at, vertebral cavities where the spinal cord's at. We're not really going to focus on that. So our thoracic cavity, what do we have here? So we're going to have the pleural cavity, if I can draw this right. So pleural cavity, so we have right and left. So that's where our lungs are, and the pericardial cavity, right? And that's where the heart sits, and that's sitting within the mediastinum. So everything in the middle here is the mediastinum. So the superior mediastinum sits above the heart, and in the heart we've got the, we'll say the inferior mediastinum, but there's three portions to that we'll get to. Okay, pleura surrounds the pleural cavity, and then pericardium surrounds the pericardial cavity. And then here we have the abdominal cavity, or really should call it the abdominopelvic cavity because it's one big open space. There's no separation between the abdominal cavity and the quote unquote pelvic cavity, right? We call some organs pelvic organs because they're down in the pelvis, but there's no separation. So the separation between the thoracic cavity and the abdominal pelvic cavity, well, that's your diaphragm. So we see your diaphragm here. We've talked about this. So your primary muscle of ventilation, that's going to separate the cavities. Some structures pass through it: esophagus, aorta, inferior vena cava. But the abdominal pelvic cavity is one large cavity lined with a serous membrane called the peritoneum. Okay, and we can see the heart separated from the lungs by the pericardium. So start getting aware of where these organs are in relation to the body surfaces. So when you're going to start examining patients and evaluating them, you're just going to see the chest wall. You're just going to see the abdominal wall, right? You're not going to be able to see their organs unless you have X-ray or MRI or ultrasound or CT vision, which I don't think anyone has, right? And CT is still X-ray. But anyway, you kind of have to know where these organs are in relation, right? In relation to the chest wall. So here we can see the lungs and the heart. So especially talking about the heart, and the outline of the heart's right here. So obviously the left ventricle is kind of sticking out to the left here. And one of the big things you're going to learn is heart sounds, right? Where do you listen to the different valves? And we mentioned this before. So here the right second intercostal space at the lateral sternal border, or that's going to be the aortic valve. The left second intercostal space, just lateral to the sternal border, or just at the sternal border. That's where we listen to the pulmonic valve. We come from 2, 3, 4 at the sternal border. So this is the tricuspid valve in the fourth intercostal space. And the fifth intercostal space at around the mid-clavicular line. So the clavicles aren't on this diagram. So mid-clavicular line's right about here. We come down here, and this is where we might get a better listen to the mitral valve. Okay. So start being aware of that. So you can see the lungs here, right lung with 3 lobes, left lung with 2 lobes. See the pericardium around the heart. See all the great vessels in the superior mediastinum. We see the trachea there. We see the thyroid gland. Here's the diaphragm sitting between the thoracic and abdominal pelvic cavities. So mediastinum, so this is more so, if you're doing any kind of surgical work, if you're in surgery or dissecting cadaver, you need to know this more so. So the posterior mediastinum, or essentially the superior mediastinum, that's where we have the great vessels of the heart. We've got the trachea, the esophagus, posterior mediastinum. So obviously the aorta, the aorta is tracking back here, esophagus, and then anterior mediastinum, we have some structures there as well. And the middle mediastinum, obviously that's where the heart's going to be. So showing it here, anterior, middle, posterior, just so you have an idea of what's going on. So here we can see the pericardium. So the pericardium is going to be surrounding the heart. So just to review, there's a parietal pericardium, and we've got the visceral pericardium. So the visceral is going to be attached to the heart surface itself. The parietal pericardium is the outer, tougher layer around the heart. And in between those two layers, we have a thin layer of fluid called serous fluid. A thin layer. We don't want a fluid collection. So here's the wall of the heart and the layers. Okay, obviously, we won't go over that right now. We talked about that before. It's just showing a pericardial effusions, right? Fluid buildup in the pericardial space, right? So between the visceral and parietal layers. So understanding that's important with the heart as well as the lungs. So obviously a fluid collection there is going to compress the heart. The heart's going to have a hard job filling with blood. Hard job, hard time? I don't know. There's a picture of the heart. Okay, again, you can see the heart sitting in the mediastinum there. There's the pericardium, got some fatty tissue around the heart. Again, 3 lobes to the right lung, 2 lobes to the left lung. This lung is pulled back to look at the whole full view of the heart. Here's the diaphragm. So again, great vessels, trachea, esophagus are going to be in the superior mediastinum. Showing this here again, just to make sure you guys got it down. We know the chest wall is just your ribs, costal cartilages, the 3 parts of the sternum, so manubrium, body, and xiphoid process, and in between the intercostal muscle, or in between the intercostal spaces, between the ribs, between the ribs, we have our external and internal intercostal muscles, which you don't see here. But showing it here, right? So again, we talk about the chest wall. We're talking about ribs, costal cartilages, sternum, and then these, these intercostal muscles. Okay, and obviously on top of this, we have other muscles like your serratus anterior, pec major, pec minor. But this is what the actual chest wall is made of. And this is a pretty good, decent picture over here. We're seeing the parietal pleura. We're seeing the visceral pleura against the lung surface itself, and in between there you have a pleural cavity or a pleural space, or however you want to put it. We talked about the negative pressure there for breathing and all that before. Pneumothorax. So you can get air in the space. That's called a pneumothorax. Could be from penetrating trauma to the chest. There's other reasons as well. And we talked about how pleural pressure has to remain negative, so the lung remains inflated, right? We can get atelectasis, or the lung can collapse if air or gets in the space. When we say air gets in the space, it's kind of a bad way of saying it. Really, it means you lose the negative pressure in the intrapleural space, okay? And a lot of times the pressure in the space will normalize with atmospheric pressure. So if intrapleural pressure is normally, say, 756 millimeters of mercury, and it varies depending what part of the lung you're at, but it's got to be less than what's in the airways in the lung. If it normalizes with atmospheric pressure, 760, when someone goes to breathe in, pressures go down inside the lung, so air moves in, and the lung collapses. So we've already talked about that. All right, let's get to the abdominal pelvic cavity. I don't know if I can move my picture, but I'm really in the way. Okay, so how do we look at the abdominal wall? We talked about the chest wall. We can break this down into areas. So there's all kinds of organs in here, right? Stomach, pancreas, liver, spleen, your 3 parts of your small intestine, your ascending colon, transverse colon, descending colon, sigmoid colon, rectum, appendix. We got your gallbladder. We've got your bladder. We've got your, if you're female, there's uterus, right? There's all these structures in here. So knowing the surface area or breaking the abdominal wall into areas gives us an idea of where these organs are. Just like we're picturing where the heart is underneath the chest wall, I'm going to picture where these organs are in the abdominal pelvic cavity. So this is one way of doing it, and you make 2 lines. So the vertical line goes between, or the vertical line basically crosses through the umbilicus vertically. Make another line that's horizontal that crosses the umbilicus as well, right? So you make these 2 lines cross, and you have 4 quadrants. A right upper quadrant here, left upper quadrant, right lower quadrant, left lower quadrant. That's pretty simple, right? But there's a better way of doing this. And of course, all your patients will look exactly like this and be this lean, which makes it easy. It's not the case. That picture's awful. I should take that off. Anyways, so there's another way of doing this, and we split the abdomen up like this, right? The abdominal wall into 9 regions. So we basically make a tic-tac-toe board. Okay, we make a tic-tac-toe board. And we get 9 regions. So how do we do this? Because it's easy with the umbilicus, make a vertical line through the umbilicus and a horizontal line through the umbilicus, and you're done. Well, we've got all these planes, right? So this first plane up top, or so the 2 horizontal lines, the one here, this is called the subcostal plane. So I'll try to write this decently, I don't have my drawing board. So subcostal. So this is right on the lower border of the ribs. So subcostal, we know costal refers to the ribs. We have another one here. This is the interspinous because this is between the spines, or specifically the anterior superior iliac spines of the pelvis, of the iliac bone. So interspinous. Okay, plane. And then the 2 vertical lines, well, what are those? Well, there's 2 ways to do that. So one is you look at the midclavicular line we talked about. The other one is you look at the semilunar line. So if you can see someone's rectus abdominis, so the 6-pack muscles, well, this line it's going through right here, this is passing through these semilunar lines. So line between the rectus abdominis here is called the linea alba, and these lines are called semilunar lines. So if you can picture those on someone, you could use those. Sometimes you can't, a lot of times you can't. You can use the midclavicular line and you can bring that down. Let's erase all this mess I put on here. So the midclavicular line, you're going to carry that down here. So find the clavicle. Here's like the AC joint. Here's the sternoclavicular joint around here. So you basically find that line, and it's going to be fairly close depending on the person, how broad their shoulders are. You bring this line down from the midclavicular line and just go straight down. Okay, and this should actually, when it gets down here, it should pretty much bisect, okay, go through the middle of the inguinal ligament. Okay, so the inguinal ligament's right here. Right, so if you make the midclavicular line, it'll bisect the clavicle, and it should somewhat bisect the inguinal ligament, and that kind of puts you on the right pace to where you're at. Okay, and again, you're not drawing these lines in someone's abdomen. You can do that to practice if you really want to, but you're kind of just estimating this. Okay, so once you have your subcostal plane in your brain and your interspinous plane, you make your 2 midclavicular lines, and that gives us 9 regions. So on the right, a right hypochondriac plane, or sorry, region, a right hypochondriac region, so that's underneath the ribs, so chondriac up underneath the ribs. So here we have a left hypochondriac region under the left ribs. In the middle, we've got the epigastric region. So epigastric, so over the stomach. Epigastric, like epidermis is over the dermis. We have a right lumbar area and a left lumbar area. So I like to call these flank areas because people usually say, oh, they got right flank pain or left flank pain. So you can say lumbar or you can say flank. Okay, we got the umbilical region in the middle because this is around your umbilicus. We've got a right inguinal region because this is down by the inguinal area, by the inguinal ligament. A left inguinal area because it's down by the left inguinal region or left inguinal ligament. And here we've got the pubic area, which a lot of times you call the hypogastric region. And those are your 9 abdominal regions. And we can look at this chart, which is very helpful, and we can see about what organs are located in these areas. So the right hypochondriac area, we got our liver. So our liver is really big. So it's going to cover our right hypochondriac area. The right lobe is really big. It's even going to dip down into the right flank area. It's going to extend into the epigastric area. So we'll see pictures of the liver, and you'll see that later. Okay. Right hypochondriac area also has your gallbladder up there, and that gallbladder can dip down into the right flank area here. So the right kidney, we're going to see there. So left kidney is usually a little lower than the right kidney, so the right kidney is up in this area. But this is retroperitoneal. This is all the way in the back. Okay. So epigastric region, we're going to have, this is where our stomach's going to be found. and our pancreas. So the stomach kind of sits on top of the pancreas. The pancreas is kind of posterior to the stomach. The left hypochondriac area, we've got our spleen and our left kidney. So the tail of the pancreas tickles the spleen. So part of the pancreas will extend in the left hypochondriac area. So there's a head and neck, a body, and a tail of the pancreas. The tail will tickle the spleen. Umbilical region, so a lot of this is just small intestine. Okay, the duodenum is going to start in the epigastric area because the duodenum is the next part of the alimentary canal after the stomach, and that'll extend into the umbilical region. Now the colon. So the right colon, that's the ascending colon, is found in the right lumbar area. Transverse colon kind of goes all the way across. Descending colon is on the left in the flank area. Okay, on the right iliac, the cecum, that's the first part of the ascending colon. Okay, so here's the ileocecal junction. The appendix is down here. Okay, no, their name's iliac. You could say inguinal or iliac because it's down where the iliac bone is in the pelvis. Left iliac area, so we have the descending colon again, which connects to the sigmoid colon, the kind of curvy S-shaped part of your colon. In the hypogastric area, you've all your pelvic organs, so urinary bladder, sigmoid colon, rectum goes down in there, and then obviously if there's uterus there, well, the uterus will be in this region as well. Okay, so I would know all those. This is showing the peritoneum. So the peritoneum has two portions to it. It's got a greater sac and a lesser sac. So the greater sac goes all around the liver here, comes all the way around like this, and it's going to have a parietal layer and it's going to have a visceral layer, and this is the greater sac. So here this transverse section is going around the liver, stomach, and spleen, and the lesser sac is here, and there's some organs that are behind the peritoneum. We call them retroperitoneal. So the kidneys, the aorta, inferior vena cava, portions of the duodenum, portions of the pancreas can be considered retroperitoneal as well. Retro, like back in the past, but behind the peritoneum. That's another picture of that there. So the digestive tract, so we're getting into the esophagus, right? So the upper part of the GI system. So obviously it starts with the oral cavity, which I'm kind of skipping over. And we get right back into the pharynx where we have swallowing. So we're going to jump ahead to this slide here. So this is a good slide. So here we've got the pharynx, okay, or the throat. So we have three main muscles: the superior pharyngeal constrictor muscle, which is here; the middle pharyngeal constrictor muscle, which is here; inferior pharyngeal constrictor muscles here. So their job is to constrict and push that food, the food bolus, down towards the opening of the esophagus, which is right here. Okay, here's the back of the tongue. Here's the opening of the airway, so the glottis, and then this flap of tissue here is the epiglottis. Okay, so when we have the swallowing reflex, the back of the tongue pushes the food into the pharynx. Epiglottis closes over the airway. We don't want to aspirate food into our airways and our lungs. And the constrictor muscles will push that food down towards the esophagus. This circular muscle of the esophagus, so this is like the upper esophageal sphincter. So there's always some muscle tone here. So when we're breathing and not eating, we don't want air in the stomach. Just like when we're eating, we don't want food in the airway. Okay. And then there's the laryngeal muscles here. So the vagus nerve is innervating most of the pharyngeal muscles, and it's also innervating a lot of the muscles around the vocal cord. So that's the recurrent laryngeal nerve, which we see here. Here's the right recurrent laryngeal nerve that actually comes back up and extends superiorly and innervates some of those muscles. So when there's damage to the recurrent laryngeal nerve, people might have hoarseness to their voice and difficulty talking. Okay, of course I can't go back. So another thing to know here is the esophagus is posterior to the trachea. So it's attached by a lot of tissue and connective tissue to the posterior aspect of the trachea. We can see that here, okay? So trachea is anterior to the esophagus. There's two layers of muscle here. So longitudinal esophageal muscles, so those are longitudinal, meaning they run superior to inferior. Circular muscles, they run medial to lateral, but really they wrap around like a circle around the esophagus. So the esophagus's job is to push food down towards the stomach. Okay, so those circular muscles and longitudinal muscles will propulse food down in the stomach. There's two kinds of peristaltic movements. There's propulsive movements, which just pushes things along, and then there's segmentation, where things get cinched off, like here and here, and things get pushed back and forth. And we see that more in the stomach and the small intestine. The stomach also has these grinding movements to mash up food. So the esophagus is going to extend to the posterior mediastinum. It's passing through the diaphragm here and entering the stomach. And you see the mucosa of the esophagus is much different than the mucosa in the stomach. The stomach has these folds called rugae, and these really deep, like gastric pits with all these specialized glands and really thick mucus and this extra layer of fluid to protect it. Because the pH of the stomach is 1.8 to 3.5, it makes all this really strong acid called hydrochloric acid from these cells called parietal cells. So the mucosa in the esophagus is not as tough or is different than that of the stomach, because the stomach needs to be really specialized to prevent itself from its own acid it's producing. We don't want hydrochloric acid to extend up into the esophagus, because that is called gastroesophageal reflux disorder. People might have symptoms of heartburn, or they might just have chronic laryngitis, hoarseness of the voice, or a sore throat. And that's because acid's getting in there. We don't want that. So if acid keeps getting into this lower esophagus, it'll damage the mucosa, right? And over time, you can end up getting changes in those mucosal cells, and they go through potential cancerous changes, and we get something called Barrett's esophagus, right? Barrett's esophagus, where it's all scarred up, and the next step from Barrett's esophagus is actually esophageal cancer. So chronic long-standing GERD is actually a risk factor for esophageal cancer. So we have a lower esophageal sphincter here that's going to control that, right? So once food goes into the stomach, we're going to keep some muscle tone here, because we don't want food to regurgitate, and we don't want acid to come back up into the esophagus. We'll see the stomach here later. We can see a picture here. It's got 3 layers of smooth muscle. Esophagus has 2. Small intestine, large intestine has 2. Longitudinal circular muscles. The stomach has an extra layer of muscle, an oblique layer, the deepest layer, which could be a test question. So blood supply to the esophagus. We see most of the esophagus is supplied with these branches off the aorta, off the thoracic portion of the aorta here. And then we also have some branches from the celiac trunk. So remember the 3 major arteries, okay, off the aorta in the abdominal cavity, or abdominal pelvic cavity, right, to all these abdominal organs are going to be the celiac trunk. And we're going to have the superior mesenteric artery and the inferior mesenteric artery. So there are some branches to the lower esophagus there. So venous return. So we have these azygous veins, so hemiazygous vein on the left and azygous vein on the right. Okay, so those are going to drain blood from the majority of the esophagus, but this lower esophagus, and this is important, drains into the hepatic portal veins. Okay, so these esophageal veins, okay, or lower esophageal veins, are going to drain into the portal system, which we'll talk about, right? So people with cirrhosis, or anyone with portal hypertension, or we call hepatic portal hypertension, blood can back up into those veins and they can get distended. We call that esophageal varices, and they can even rupture, and people will be bleeding a lot, and that's bad. So there's lots of lymphatic tissue in the digestive system, just like the airways, especially through the intestines. The greatest amount is in the ileum, the last part of the small intestine, and there's a specialized name for that. We call those the Peyer's patches. So innervation of the esophagus and the stomach. So vagus nerve provides all the parasympathetic innervation, and then we're going to have sympathetic splanchnic nerves. So we know parasympathetic is rest and digest. It's going to increase secretions, increase motility of the esophagus and the stomach, where sympathetic is going to do the opposite. Okay, if you remember the autonomic nervous system. So the abdominal wall anatomy, we're not going to get into all the details, but obviously there's the skin, there's the subcutaneous fat. There's 2 kinds of fascia, Camper's fascia and Scarpa's fascia. Here we see the rectus sheath. So this white tissue here is the rectus sheath. It's fascia over top the rectus abdominis, or your 6-pack muscle. On the side, you've got your oblique muscles, or here's your external oblique muscles. Up here, stratus anterior, pec major. So the line in the middle is called the linea alba, and then these are the semilunar lines. So lines on the side, the lines on the sides here of the 6-pack muscle, those are the semilunar lines. And then in the middle, this is the linea alba. Okay. Then deep to that, we can see the rectus abdominis with the sheath removed. We can see the internal oblique, which is deep to the external oblique, and this isn't showing it, but deep to the internal oblique, we have another muscle called the transverse abdominis. So there's 4 abdominal muscles: rectus abdominis, external obliques, internal obliques, and the transverse abdominis. And then deep to that's the peritoneum, which is going to line the majority of the cavity. And then here's the inguinal ligament, which extends from the ASIS down to the pubic tubercle. Okay, and we see this is a male, so the spermatic cord is coming out there. So there's different rings, and if we have time later, we'll talk about hernias. Okay, but this is the inguinal ligament there. Okay. So another picture there. So this is showing those 9 regions again, so we can see the 2 horizontal lines, the subcostal plane, interspinous plane. So subcostal plane's here. It's a different color maybe. So subcostal plane is here. Interspinous plane is here. There's your 2 horizontal lines, your 2 vertical lines. Again, you could use the semilunar lines. Okay, or you could use the midclavicular lines. Midclavicular lines, I think, are easier. Like I said, that should kind of divide the inguinal ligaments kind of near the middle. So we remove the abdominal wall. What do we see? Well, this is the top picture here. Well, we see a portion of the liver peeking out from underneath the ribs. We can see it's in the right hypochondriac area, a little bit in the right flank area, and all the way in the epigastric area. It's got a right lobe and a main left lobe. We got a little bit of the gallbladder peeking out. We have the stomach, which is sitting on top of the pancreas, and this big flap of fatty connective tissue, and that's called the greater omentum. So it's attached to the greater curvature of the stomach and the transverse colon. So this bottom picture, the transverse colon, which is this right here, is flipped up, the stomach, and here we can see the small intestine, which really is the jejunum and the ileum. We'll see the duodenum's only about 8 to 10 inches long, this little C-shaped structure, and then your jejunum and ileum are like on average total, both of them like are 18 feet, and that's what you see in this middle area. Okay, which should correlate with like your umbilical area more or less. So we're pulling the small intestines out. So we have something called the mesocolon. So the mesocolon is this tissue holding the blood vessels around the colon here. And then this tissue holding on the small intestines is the mesentery. So it holds blood vessels and holds all that stuff in place. So we're going to have 3 blood vessels. We're going to have your celiac trunk here, your superior mesenteric artery here, and then here we can see your inferior mesenteric artery. Okay. And we'll touch on those later. So we're pulling the stomach up here, so we cut the greater omentum from the greater curvature of the stomach. And what's behind the stomach? Here we got the spleen. And the tail of the spleen's tickling the pancreas. Ugh. Here's the spleen, the head, the neck, the body, and the tail, and that's tickling the spleen here. Pull the liver up. Here we can see a better view of the gallbladder. And then here's the transverse colon with the greater omentum hanging off. Okay, so really the gallbladder is sitting posterior to the liver, and the pancreas is posterior to the stomach. The spleen is up here in the left hypochondriac area. Spleen's not part of the digestive system. We know it's part of the lymphatic system, recycles old red blood cells, and has immune function. So pull the liver out of the way. There's some ligaments between the stomach and the liver. There's different parts of the stomach. So the little cap on top of the stomach is called the fundus. This is called the cardiac portion of the cardia. This is the body of the stomach. Where the stomach starts to taper, we call this the pylorus or pyloric region of the stomach. And it's going to end here in what we call the pyloric sphincter, which controls chyme release from the stomach into the first part of the small intestine here, which is the duodenum. So here we can see the stomach with the gastric folds or rugae. Okay, here's where the esophagus is entering the stomach. So greater curvature is the big spoon here, lesser curvature is the little spoon. Here we got our pyloric sphincter, which is entering the duodenum. Okay, so food from the stomach, we call it chyme, and it's going to exit that way. So there's all these different cells, some mucus cells that make mucus, the parietal cells make hydrochloric acid and intrinsic factor, chief cells make something called pepsinogen, which breaks down the pepsin and digests proteins. Stomach also releases gastrin, ghrelin, all these endocrine hormones released from the digestive system that we'll touch on later. So stomach, 3 layers of muscle. The outermost layer is the longitudinal muscle, then we have a circular muscle, and then the innermost layer is the oblique muscle. So 3 layers is unique to the stomach. We talked about the portions. Okay. And the next part is the duodenum. So here's the duodenum, this little C-shaped structure. Little, it's again 8 to 10 inches, and then this is the opening from the duodenum into the jejunum. So make sure you know the order of the alimentary canal. So duodenum, jejunum, ileum. The head of the pancreas is kind of wedged right in the curve here. Okay, and then the pancreas has a neck, a body, and a tail, and that tail is way over here, tickling the spleen in the left hypochondriac region. The transverse colon here has been cut away, cut here, and cut here, so we can see all this stuff. So the duodenum sitting behind the transverse colon. So inside the duodenum, one of the important things is right here. So there's contents that get dumped into the duodenum. Okay, this is at the ampulla of Vater, V-A-T-E-R. There's a little sphincter of smooth muscle that controls the release of these substances called the sphincter of Oddi. So what are these tubes that are entering here? One's the common bile duct, which dumps bile into the duodenum. That bile is coming from the liver and the gallbladder. Bile is made in the liver, and it's stored, concentrated, and secreted by the gallbladder. And we have the main pancreatic duct, which is dumping digestive enzymes and bicarbonate from the pancreas. The bicarbonate's there to neutralize all the hydrochloric acid, all the hydrogen ions getting dumped from the chyme, from the stomach, into the duodenum. And all the enzymes are to digest proteins, fats, and carbohydrates. So here we can see the jejunum and the ileum. So here's the duodenum. There's technically 4 parts of the duodenum. You don't need to know that. And then we have the jejunum and the ileum, and these beautiful arterial loops. So this is the superior mesenteric artery here that supplies the jejunum, the ileum, the cecum, ascending colon, and the transverse colon, where the inferior mesenteric artery is supplying the descending colon, sigmoid colon, and rectum. Okay, so the mesentery is what's holding all these blood vessels in place. It looks very nice. On the small intestine, this is where we're going to get a lot of we'll complete digestion, chemical digestion of nutrients, and then we have absorption of our nutrients there. Okay, so the first part of the colon is the cecum, right here. And hanging off the cecum is this little worm-looking thing, and that's called your appendix. Between those two structures, we have a valve called the ileocecal valve. Here's the opening of the ileocecal valve. You can see it here. So this can control movement of that chyme from the ileum into the large intestine. And here we can see the variform appendix hanging off there. And there actually is a little opening to the appendix where someone can get down in there and stuck, and the appendix can get inflamed and swollen and potentially rupture, dumping bacteria into your abdominal pelvic cavity. Let me see that. Okay, so the large intestine. So we've got all the portions you need to know. So we got the cecum is the first portion. The ascending colon, so this is your right flank area extending superiorly. Then we have your right hepatic flexure. It makes a 90-degree turn. This is your transverse colon going across. It makes another 90-degree turn. It's called your splenic flexure. And then downward, this is your descending colon. Okay, then you have an S-shaped portion like this, which is your sigmoid colon, and that goes to your rectum. And then there's 2 sphincters. There's an internal anal sphincter, which is made of smooth muscle, so it's involuntary, and then an external anal sphincter, which is skeletal muscle, which is hopefully voluntary. And the pelvic floor muscles also help with defecation. So these little sacs, we're seeing, so this one little like sac structure is called a haustra, and this long ligament that I kind of drew over is called a tenae coli. Okay, different variations in the colon orientation. So Here we've got the liver. So the liver is right underneath the diaphragm, connected with the ligament. So here's the border of the diaphragm. We have two lobes of the liver, or main lobes of the liver. We've got the right lobe at the left lobe. This is separated by this ligament called the falciform ligament, which ends in the round ligament here. So this is the separation here. See a little bit of gallbladder peeking out underneath. On the posterior aspect, there's two smaller lobes, the caudate lobe, which is more superior, and the quadrate lobe, which is more inferior. So the liver is going to make bile. So in regards to digestion, the liver makes bile, and bile is going to be made of water, electrolytes, cholesterol, and bile salts. Bile salts are actually derived from cholesterol, and the bile salts actually help emulsify fats, meaning break larger pieces of fat into smaller pieces of fat. There's also bile pigments. So bile pigments are your bilirubin, biliverdin from the breakdown of heme. That's when people have jaundice. They're not excreting the bile pigments. People have an acholic stool. Acholic is like a clay-colored stool. You can see how ginormous the liver is. So right hypochondriac area, even down to the right flank area a little bit, and then all the way through the epigastric area. Big liver. There's some sub-segments of the lobes of the liver, which you'll see there. So here's the hepatic triad. Hepatic triad, right? If I make a circle in here, hepatic triad, there's three things entering the liver, or exiting the liver, or entering or exiting together, however you want to put it. The hepatic artery proper is bringing in blood supply. That's a branch off the celiac trunk. We have the common bile duct, which is draining bile from the liver. That's going to meet the cystic duct from the gallbladder and form the common bile duct, and that'll dump into the duodenum at the ampulla vator. And then we've got this big vein called the hepatic portal vein. So liver has two veins. Hepatic vein that drains venous blood from the liver, okay, and that's going to dump into the inferior vena cava. But this hepatic portal vein, this is taking blood from the stomach, the spleen, the pancreas, the small intestine, large intestine, all the way to the superior rectal veins. So, and this is passing to the liver, and this makes sense because when you're absorbing nutrients, especially to the small intestine, it's going to pass through the liver first. So the liver can say, hey, I'm going to take some of this glucose, store as glycogen. I'm going to store these fat-soluble vitamins A, D, E, and K. I'm going to store minerals like iron. So there's a lot of iron in your liver. Your liver's going to say, I'm going to take these fatty acids to make different lipoproteins. I'm going to take all those amino acids and make all these proteins. When the liver makes albumin, which maintains the blood's oncotic pressure, all those clotting factors, which we need vitamin K to make, which is a fat-soluble vitamin, and the liver makes these clotting factors, especially fibrinogen, and other stuff, right? So all these lipoproteins like HDL, LDL, VLDL, all these blood proteins like albumin, your clotting factors. So there's kind of first dibs on all that stuff, which makes sense. And then all drugs you take by mouth, right, any oral medication is going to pass to the liver. We call this first pass metabolism. You're going to learn this in pharmacology. And the amount of drug that passes the liver and gets into the blood, we call that your oral bioavailability. So if you take 100 milligrams of medication, 50 milligrams gets into your blood, well, then it's an oral bioavailability of 50%. You take 100 milligrams of a drug and 100 milligrams gets in your blood, well, it has a 100% oral bioavailability. So drugs with poor oral bioavailability, that's why sometimes we give medications by intramuscular injection, subcutaneous injection, IV injection. Okay, so that does change how the drugs are absorbed. Okay. Just showing the hepatocytes making the bile. So this is the biliary tree. So right in this bottom picture, this is the biliary tree. So we already talked about this. There's a right and left hepatic duct from the right and left lobe. They form to meet the common hepatic duct. That meets the cystic duct to form this thing, the common bile duct. And that's going to meet with the pancreatic duct, or the main pancreatic duct at the ampulla vator, and dump their contents into the duodenum. Very, very important. Okay, and we'll talk about all the enteroendocrine hormones that control that. So here we can see the sphincter of Oddi, the smooth muscle there, right? That's controlling the release of these things into the duodenum. So cholecystokinin is one of the hormones that affects that. There's different variations in how these are connected. So we can see the pancreas here, so head, neck, body, and tail. Tail's tickling the spleen there. So there's a main pancreatic duct, and then sometimes we have this accessory pancreatic duct, or we call it the duct of Santorini. So pancreas is going to make bicarbonate and digestive enzymes. So here we can see the blood supply here. So this artery is go back to blue, this artery is the celiac trunk. It's going to supply the liver, the gallbladder, the spleen, the stomach, the pancreas, all this stuff. All the stuff on top. We see that there are all the branches, celiac trunk. Okay, the supramesenteric artery, we kind of already saw this picture. This is going to supply the jejunum, the ileum, the cecum, the ascending colon, the transverse colon. Inferior mesenteric artery is going to supply the descending colon from the splenic flexure to the sigmoid colon to the rectum. So there's collateral circulation right here between the SMA and the IMA. So SMA also does this and this. Okay, that's where they meet up. So portal system we talked about, so all the venous drainage from all these things all the way down to the superior rectal veins are going to drain into the hepatic portal vein into the liver. The middle and inferior rectal veins won't, and that's why anything that's given by suppository, certain medications will get absorbed by the middle and inferior rectal veins and bypass the portal system. So we talked about how alcohol or rectal alcohol can lead to alcohol poisoning that way, because alcohol is usually metabolized by enzymes in the stomach called alcohol dehydrogenases, and then the liver with the cytochrome P450 system, it metabolizes toxins. So we try to metabolize as much alcohol as possible, ethyl alcohol, the alcohol you drink, and liquor, beer, and wine before it gets to your blood. So if you put it in your rectum, it'll pass right into your systemic circulation, and that's where things can get scary. So lots of lymphatic tissue around the GI system, especially the small intestine and large intestine, because there's lots of bacteria there. So we got to be careful what gets into our blood. Okay, so lymphatic tissue there. So innervation, so again, vagus nerve is going to innervate everything to the splenic flexure, okay? And then splanchnic nerves from the thoracolumbar spinal cord will innervate things as well. So the vagus nerve does everything all the way to here, and then the S2, S3, and S4 do the rest. So here, again, vagus nerve, okay, up top here, S2, S3, S4. So the vagus nerve is going to do everything right up until this point. S2 and S3, S4 everything below there, parasympathetic wise. And sympathetic, obviously the thoracolumbar spinal cord, all the splanchnic nerves will have sympathetic control. So layers of the intestines and the wall. So we talked about the serosa is the outer connective tissue layer. We've got the longitudinal muscles. We got the circular muscles. We got the myenteric nerve plexus controlling the muscles. Underneath the circular muscles, we have the submucosal plexus, which controls the glands, right? Then we have a submucosa, mucosa, and then the lumen, which is the opening inside. So the submucosal plexus will control secretions, right, which is also controlled by the autonomic nervous system. Same picture. And there's the peritoneum, greater and lesser sacs. That's it.